I'd like you to think back to the last time you visited a fast food restaurant with a child. Let's call this child Johnny. As you walk in, you see a sign with a kid's meal, complete with a juicy burger, a fun toy, and an ice cold orange soda. Johnny decides he wants that meal with that toy and that soda. You, being the responsible adult you are, decide you're going to get Johnny the kid's meal, but with a milk instead of a soda. But Johnny doesn't like that, and soon he's screaming on the floor. But what if Johnny never saw the orange soda with the kid's meal? What if every kid's meal automatically came with a healthy beverage? Today, we have healthy kids' meal policies that do exactly that. The majority of these require the default beverage of kids' meals to be healthy, like water or milk. And they have been implemented in about 20 different jurisdictions across the US. And in theory, these policies are great. However, one of the tricky things about knowing whether or not these policies work is really understanding what they specify and how they're being implemented in the real world. My research sets out to understand what these policies say and explore how restaurants are interpreting and implementing them. So first, I set out to collect all documentation on any healthy kids meal in the US. I mapped out what was included in the legislation and the regulatory text, and then created a data set where you could look up each policy and see what beverages are healthy, where they need to be displayed, and all kinds of information. I also assessed whether or not these beverages met nutrition recommendations. And what I found was that the implementation language included in all of these policies was diverse, especially around implementation and enforcement. And while these policies are designed to create healthier restaurant options for kids, no policy actually followed the nutrition recommendations. So in the coming weeks, I will interview the restaurant managers to see if they were able to implement the policies as currently written. I'll explore those barriers and facilitators that they may experience when implementing the policy. And we know this is important because we know that inconsistent implementation can lead to inconsistent outcomes down the road. So what if these policies are actually including healthier beverages per nutrition recommendations, and we know what support restaurants need to successfully implement them? We might start to get healthier options for kids in restaurants more consistently, and Johnny wouldn't be so upset about the orange soda because he wouldn't even know that that was an option. Then perhaps we as a country would start to have healthier dietary habits, like drinking water with our meals rather than sugary drinks, and a future where a healthier restaurant environment leads to better health, a better quality of life, and less tantrums because Johnny wants an orange soda.